These grafts that are going in, there's a bit of graft on the surface, i.e. the hair shaft, but the main body, the growth bit of the graft, is underneath the surface of the skin. Often what one finds is the shaft of the hair that you can see on the outside of the scalp, that falls out after 2 or 3 weeks, but the root will still be alive, and that's the bit that starts to grow 3 or 4 months after surgery. The bit on the outside of the scalp, i.e. the hair shaft that you can just about see, sometimes that would be visible if you were totally bald, so a lot of men prefer to get these procedures done before they lose their hair, so that the results of surgery wouldn't be conspicuous in those first few weeks after treatment. So it's almost preventative, which is probably a bad phrase, but what it means is that it's being disguised by your existing hair. We played out the grafts according to the time that they were removed. So the first grafts that were removed are identified and marked accordingly, so that we can put those grafts that first came out back into the scalp first. That way, again, it minimises the out-of-body time. So the first hour of harvest, they'll be in one petri dish. The second hour of harvest will be in another petri dish. So we've identified those grafts that need to get in earliest. And that is very similar to human body fluid, but it's chilled. Again, it's to minimise the metabolism of the grafts, again, optimising survival. And it's not just about survival of the graft, but it's also about, will it grow a good natural quality, good quality hair? Because we want that hair to look, again, just as natural as possible. One thing worse than no hair growth is bad hair growth, and that's one thing that one wishes to avoid. So you see there's not much bleeding, and that's because the planters are so efficient at planting that they're not having to traumatise the incisions. It's very ergonomic. Every move is calculated, because if one wastes a second with every graft and you're transplanting 2,000 grafts, that's 2,000 seconds wasted, which is additional time for the hair out of the body that doesn't need to be. So it takes a while just to be able to coordinate that and just get a sequence in place for the whole team, so that we can do this in as efficient and atraumatic a fashion as possible. You can see that the hair that the planters are working their way through here, that's all transplanted hair from Kenny's first transplant. There's no need to shave the top of the scalp to do this procedure. With wetting of the hair and appropriate magnification, such as what the planters are using at the moment, there's no need to shave the scalp for transplantation purposes.